Heart failure might sound like your heart has completely stopped working. In reality, heart failure means your heart isn't pumping blood as well as it should. Think of your heart as a powerful, tireless pump. Its main job is to send oxygen-rich blood to all parts of your body. When this pump becomes less efficient, it struggles to meet the body's demands. This condition can develop slowly over many years. It is a serious condition, but with proper care, many people live full lives. Understanding this is the first step to managing it effectively. There are generally two main ways the heart's pumping action can be affected. The first is called systolic heart failure. This occurs when the heart muscle doesn't contract with enough force. The second type is diastolic heart failure. Here, the heart muscle becomes stiff and doesn't relax properly between beats. Both types result in the body not getting the blood supply it needs. Your doctor can determine which type you might have. It's a complex situation where the body's attempts to help can sometimes worsen the problem if left unmanaged. With the right medical care, lifestyle adjustments, and support, people with heart failure can manage their symptoms and improve their quality of life significantly. One of the most common symptoms of heart failure is shortness of breath. You might notice this during physical activity, like climbing stairs. Sometimes it can happen even when you are resting. Some people find it hard to breathe when lying flat in bed. This breathlessness occurs because fluid can back up into the lungs. Recognizing this early is crucial for seeking help. Another frequent sign is feeling unusually tired or weak. When your heart isn't pumping effectively, your body's cells don't get enough oxygen-rich blood. Everyday activities that used to be easy might suddenly feel exhausting. Swelling, medically termed edema, is also a telltale symptom. This often occurs in the legs, ankles, and feet. Swelling can also happen in the abdomen, which might feel bloated. Other symptoms can also indicate heart failure, like a rapid or irregular heartbeat, persistent cough, or wheezing. A loss of appetite or feeling nauseous is another possible sign. If you notice any of these symptoms, especially if they are new or worsening, consult your doctor. Several underlying conditions can lead to heart failure. One of the most common culprits is coronary artery disease. This is when the arteries supplying blood to your heart muscle become narrowed or blocked by fatty deposits called plaques. A heart attack, which is often a result of coronary artery disease, can also cause heart failure. High blood pressure or hypertension is another major contributor to heart failure. When your blood pressure is consistently high, your heart has to work much harder to pump blood throughout your body. Over many years, this extra strain can cause the heart muscle to become thicker and stiffer. Various other medical conditions can also increase the risk of developing heart failure. Faulty heart valves are one such example. Diseases of the heart muscle itself, known as cardiomyopathies, can also cause heart failure. Diabetes is another significant risk factor. Lifestyle choices play a significant role in the development of heart failure. Smoking tobacco is extremely harmful to your heart and blood vessels. Being overweight or obese puts extra strain on your heart. Recognizing these risk factors is the first step towards prevention. Section 4. Taking action, treatments and healthy lifestyle choices. Fortunately, there are many effective treatments available for heart failure. Medications are a cornerstone of managing this condition. Doctors often prescribe a combination of drugs. ACE inhibitors and ARBs help relax blood vessels, lowering blood pressure and reducing the heart's workload. Beta blockers can slow your heart rate and also lower blood pressure, allowing the heart to beat more efficiently. Diuretics, sometimes called water pills, help your body get rid of excess fluid and salt. This can reduce swelling and make breathing easier. Lifestyle changes are just as crucial as medications in managing heart failure. Adopting a heart-healthy diet is paramount. Regular physical activity, as approved by your doctor, can strengthen your heart and improve circulation. Other lifestyle adjustments are also key to managing heart failure effectively. If you smoke, quitting is one of the most impactful steps you can take for your heart health. Limiting or avoiding alcohol is also recommended. Managing stress through techniques like meditation, yoga, or spending time in nature can be very helpful. In some cases, more advanced treatments may be necessary, such as pacemakers or even a heart transplant. Section 5. Early detection and living well. A hopeful outlook. Early diagnosis in heart failure is crucial. If you experience symptoms like persistent shortness of breath, fatigue, or swelling, do not ignore them. See your doctor for evaluation. Early detection allows timely intervention. This can slow the condition's progression. It can also improve your quality of life. Regular checkups and following your treatment plan are vital. Heart failure management is a team effort. This team includes you, your doctor, nurses, and other specialists like cardiologists or dietitians. Be open with your healthcare providers. Living a full life with heart failure is possible. Focus on what you can do, not what you cannot. Emotional support from family, friends, or support groups is beneficial. With proactive management and a positive attitude, individuals with heart failure can lead meaningful lives.